Candy at the University of Tasmania, and she's going to talk to us about how an Australian university improves community health and well-being. So Lucy, I will give you the 5-minute warning if the computer up and running.
Yes.
Sure. There we are. Good. Hey, cool.
Excellent.
All right.
Okay.
Over yours.
Thank you, and thank you very much for coming along to listen to all of us today. Just to give you a little bit of context, I'm from Tasmania, which is Australia's island state that some of you may or may not have heard of. We have a population of about 500,000. I'm from a small community which is called Launceston, and that community is about 120,000, so a bit similar to Kelowna in fact. Now in Tasmania we have a lot of issues with the health of our population. We have a high level of chronic condition, and in fact 44.9% have 3 or more chronic conditions in our community, and over half of our population are reliant on government funding for living, which is a really amazing statistic. And we have a low level of physical activity participation as well. So a really important community to do some health promotion work. So Active Tasmania began as a project called Active Launceston, which was just for one community, and it was started simply as a community engagement project around health promotion. So it didn't start as a research project, but obviously since the time has gone on, we have adapted our project to have some research outcomes as well. It's been evaluated from the start, and I'll tell you a little bit more about that. The way that Active Tasmania now works is that we actually provide consultancies and project management to the community. So it's auspiced by the University of Tasmania, and we have funding from lots of different streams. So from the local council, the Launceston City Council, from the state government, and also lots of private clients as well that provide funding for us to run programs on their behalf. So we are underpinned by the Ottawa Charter, which we've heard about already this morning and that we'll hear a lot more about. And after I go back, I'll be changing a lot of our policies to be reflecting the Kelowna Charter, I hope, so that we can be right on the money with what we are promoting in Tasmania. There are really 5 things that we do with our program. So we have cross-sectional community-wide programs, we have workplace health and wellbeing programs, undergraduate units and postgraduate research as well, which at the moment is me, because we struggled. It was interesting actually, I used to work for the local council as a recreation officer, and when I moved to the university I thought, wow, I'm going to have all of these researchers jumping all over this project and that's going to be great. But of course what I didn't understand is what you will all understand, that research still needs money. So my biggest struggle with my program is attracting funding, and attracting enough funding to simply operate our program and to employ our staff, and then finding research money to measure the outcomes of what we're doing is an added challenge on top of that. So obviously in terms of the university sense, it provides fabulous outcomes for research, for teaching, and I'll speak a bit more about the student involvement, and community engagement. Our university is based on the main 3 pillars, which most universities are, so research, teaching and community engagement. But community engagement is always the poor cousin, so I'm always the one who's jumping up and down against the research and the teaching agenda, and trying to make ourselves be heard and make ourselves be known. So what we try to do consistently is make sure that we are having more teaching outcomes and more research outcomes so that we can fit within the core business of the university. So since Active Tasmania started back in 2008, we've attracted $2.3 million. As I've just spoken about a little bit, we have a plan called Open to Talent, which is our strategic plan. So we're trying really hard to make sure that we fit in there so we can get the hierarchy within the university. And as Mark Doris was talking about this morning, playing the game. I feel like that's the key part of my position description, is I have to play the game with the bureaucracy and the people in power within the university. So we've had a huge level of student involvement. 105 students between 2008 and 2012, and between 2 and 92 placement hours. The primal students that we have are exercise science students, or sports science students, some universities call it, but also education students, so students that are training to be physical education teachers in schools. The way the majority of our programs run is we have a free program in the park. Let's take yoga for example. It'll be based on a specific target group. We employ an instructor from the community. So the other thing with our programs is they're seen to be, somebody once called us an economic multiplier, which I thought was a great term. I'll put that in my reports. So the majority of the money that comes into us actually goes back out to employ yoga instructors, personal trainers, the judo club, the mountain biking club, and we actually pay them to run the programs on our behalf. So the students have the opportunity to support them in delivering the sessions for community members. So these are our current projects, and I'll run through a little bit more on each of those. Active Launceston, as I said, was where the program began, and that is our key project. So Active Launceston is based in the community. It's very much around trying to find those people in the community who are most at need. So we have specific target groups, being older people, youth at risk, 0 to 5, people with chronic conditions, and again, a very important one for us is those from lower socioeconomic backgrounds. So trying to engage them, looking at what barriers they may have to participation in physical activity, and trying to help them overcome those barriers. We have heaps of programs. We have sports, we have things like yoga, we do laser tag, we do rock climbing, and in fact we took an 82-year-old rock climbing in Launceston's Gorge, which was an amazing experience, and all she wanted to do was get to the top and have a photo so that she could take it home to her grandchildren and prove to them that Granny could climb a mountain too. It's all about creating networks and partnerships. It's based on a partnership model, and it's about providing opportunities for community members to engage in programs. And for example, our programs are a short period of time, so 8 to 12 weeks. And if you come along as a participant, and Lucy's the yoga instructor, you come through Active Launceston, it's free, you engage, you make a connection with Lucy, and then you're willing to go to the yoga centre and pay Lucy $5 to participate, because you've been able to overcome whatever those barriers were to help you engage in the program. So it's about making sure that we are building capacity within the community and providing opportunities also for our providers in the community to make networks with those in our community that they wouldn't normally have access to. And just for example, we ran 17 different programs in 2014. So as I said before, we have built some research around this community engagement project, and that's primarily around Active Launceston at this stage. It's a mixed method evaluation, and we've had online surveys, focus groups, stakeholder interviews, and a cross-sectional serial telephone survey. Now, we actually did that before the program began in 2008. We did it at the end of 2009 as a pilot, end of the pilot, and again at the end of 2012. And we've got another a collection of data at the end of 2015, which will be the end of another funding cycle. Demographic analysis, obviously we collect information on all of the people who participate in our programs, and you can see the hours and the sessions there, so 23,000 hours of physical activity between that time. In terms of the qualitative outcomes, the focus groups and stakeholder interviews identified those three issues, so personal benefits, increased exercise and activities, health benefits, personal development and social engagement. And I think the social engagement one is really interesting, particularly because that's the immediate effect, that people have something to do. People have a sense of belonging. We had one gentleman who came to a dancing program who said that he now has something to tell his family when they ring up. He's done something. He's got something in his week to talk about. So that's the immediate outcome. Some of the long-term health outcomes are going to take longer, and that's why we have to keep getting funding so we can keep measuring those outcomes over time. So it really is just a process and impact evaluation at this stage. Now, this is the exciting data that we're still doing some further analysis on. However, since 2008, between 2008 and 2012, we saw a 22.7% increase in physical activity participation during the last 12 months, which is a huge jump for us in a community where we have very low physical activity participation. And moderate increase as well at 17.1%, and even vigorous at 18.1%. Okay, so now I'll just talk a little bit about each of the other projects that we're doing, and these are more projects that are on a consultancy type basis, but that consultancy provides opportunities for the university. So this is a new and very exciting one for us, and we had one of our speakers this morning talking about rural and remote services. So the Royal Flying Doctors Service in Australia is a very famous brand and a very famous service that primarily does patient retrieval. So if you break your leg out in the middle of desert Australia, the Royal Flying Doctors will come and retrieve you and take you to the nearest hospital. In Tasmania, it's a little bit different. We do have rural and remote areas, but not quite the same as mainland Australia. So we've developed a partnership with the Royal Flying Doctors to run primary health care at rural and remote events. So we will be taking exercise science students, health promotion students, psychology students out to rural and remote areas and testing things such as heart rate, blood pressure, cholesterol, and also everything from grip strength, mental health checks in terms of suicide reduction. We'll also be doing physical activity, and it's very much about engaging with the community before we attend, looking at what services they currently have, and trying to fill the gap. So for example, if they haven't had the breast screening van in their community for a long time, we would make a partnership to bring Cancer Council to that community to have breast screening done. If they don't have a local GP, we would be bringing a GP service in. So there's huge outcomes for the university in terms of student engagement and working with rural and remote areas, and particularly the Aboriginal population in Tasmania, but also great outcomes for research potential with this new project. And I've actually been able to get some research funding so that that's not going to be an ongoing struggle for us with this project. Healthy You. So most relevant to this conference today, this is our health and wellbeing program for the staff at the University of Tasmania, and Active Tasmania runs that across the state of Tasmania and also for campuses in Sydney. It's a holistic health and wellbeing, as we've already heard about a lot this morning, and in last year we had 3,350 attend our sessions out of, there's 2,400 employees with a session of attendance of 3,350, so obviously some people participated more than once. But look, it's a really great program. It's a great start. After a lot of the stuff I've already heard this morning, I'm excited about what we can go back and improve in our community and at our university, and particularly having more of a focus on the students, because this has been a struggle for us to get this funding. And to give you an idea, we were granted 75,000 Australian dollars to run this program per year, but that's a struggle for us to get that every year. So if we were going to run a program for students as well, I'd be looking to obviously double, if not more, that request in terms of funding. State government health department, so we run a program for their staff as well. Again, physical activity, nutrition, mental health, hydration, drugs and alcohol. There's 12 different primary healthcare sites across the north of the state, 3,000 employees, and we also had a reasonable session attendance there. Our state health department, like a lot in Australia, is really struggling for funding. It's going to be really interesting in the next 6 months to see whether they prioritise health promotion within their hospitals and healthcare centres as a priority for their staff. And of course, being a healthy setting, we would hope that they're going to be leading the way, but it's already a challenge. And it's actually, in Tasmania, it's mandated by law that they run a staff health and wellbeing program. And we hope that that's not more than just a tick box exercise, that they will actually be running initiatives through us for that program. Hawthorn Football Club, so AFL football, Tasmania and Launceston is particularly lucky to have a relationship with a mainland football team, and they come to our community 5 times a year and play at our local football stadium. And this is a partnership that is sponsored by our state government in terms of the economic benefit that having a football club playing in your community brings. So we have a relationship with Hawthorn Football Club where we provide games and activities for families and children pre-game, during half-time and post-game as well. And again, that's about trying to promote the message that you don't go to the football just to watch the football, sit in the stadium, drink a beer and eat a pie. but it's actually also about being healthy as well. This is a really fabulous opportunity for students, and we have students knocking on our door constantly to be involved in this, because they then get a free ticket to go and watch the game as well. But it's really great, and we also get to engage with a very different demographic at the football games and promote our message. So it's quite an exciting partnership for us. Foundations of active living. So as I said before, funding is a struggle for us and a consistent struggle. We did quite an innovative thing and developed a partnership with the Faculty of Health, where we designed a free online training course around the basics of active and healthy living. And that course is free for people to participate in, but it actually attracts funding from the federal government. So we as Active Tasmania get a cut per student. So the more students that we can get to enrol in that program, the more money that we can get to run our core projects. Okay, thank you. So this is really exciting and something that builds on our budget, but also provides that basic learning for people about the importance of health and wellbeing to them as an individual, but also the importance to them as a community. Challenges I've spoken about as all the way through. So funding is our major challenge, and because of funding and non-continuity of funding, it's hard to retain key staff for us. Competing strategic directions of the partners as well. We have Hawthorn Football Club that want us to go one way. We have the Launceston City Council that want us to go this way. The university want us to do more research. So it's about how do we balance, as an overall community engagement, health promotion project, those key objectives of our partners and the people that we are responsible to report to for our outcomes. And it's about how we can bring them all along for the journey, so that we're trying to achieve things for the different target groups and different population groups that we are trying to support and access, and at the end of the day, improve their quality of life. Okay, now I've just got a little bit of to show you, if I can get it to work. So I might get you to stand up. Stand up again. And this is just 2 minutes, so hopefully it'll be so I don't get in trouble. Oh, here we go. We've got action. So, yeah, from beginning. So this is just to give you a visual of all of the different programs and the different people that we support. And feel free to, have a bit of a groove if you want.
Like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Come back new, fucking this and that.
Lost the music, still got photos. So, while they're still going in the background, are there any questions that anybody has? Yeah.
Hi, how you going?
Hi, good. Oh, Australian, nice voice.
I'm really interested in how you got this program into the university. I'm currently looking at why universities in my PhD are
Okay.
moving to health promotion and away from more of an OHS kind of approach, I guess.
Yeah.
So I'm interested why universities decided to take it on.
Because I'm a good nagger.
Yeah, okay.
Yeah. As I said, I used to be a recreation officer with the local council, and the opportunity came. There was funding through the Active Healthy Australia's Communities program, and we wanted to put a grant application into that. And there was already a good relationship between our Vice Chancellor and the Mayor of the Launceston City Council. And I fought really hard that it shouldn't be under the local government banner, because I knew after working in local government for 5 years the bureaucracies that you would have to go through. So I wanted it to be really based in an apolitical organisation so we could get funding from local and state government. But at the end of the day it was about key personnel. I found a Deputy Vice Chancellor that had an interest in this and befriended her and was able to. Yeah, so I was seconded at the time from council over to the university, and so I've been there since 2008 I'm a project manager, so that's my role. And as I said before, I kind of thought I'd have researchers everywhere, but I didn't have that, and they kind of said, well, if you want research done on this, you better sign up for your PhD. So that brings me to that now too.
Good, thank you.
The time's up.
Yes.
Thank you very much.
No worries.
Appreciate the questions and the discussion.